Doctor Says 360.
Hi, my name is Dr. James Cobb. I'm an ENT specialist. What to do when we experience vertigo? So my advice, if you have a vertigo attack, if the vertigo is very brief, it goes away the next day, you can just leave it alone. Because sometimes even if you're very tired, if you're dehydrated, you did not have a good sleep, or you maybe had a few alcohols the night before, you can get a bit of dizziness, and that will generally go away. But if the dizziness lasts prolonged, it becomes more severe and it keeps coming back, then I would advise you to see a doctor. And which kind of doctor you should see? I think you should look for a doctor who has experience with treating patients with vertigo. So a doctor with experience treating patients with vertigo will be able to, like I mentioned earlier, to pick out exactly what is the cause of your vertigo and treat it accordingly. What are the treatments of vertigo? So again, I think we mentioned the treatment of vertigo really depends on the cause of the vertigo. It can be medication, it can come in the form of vestibular rehabilitation, positional maneuvers. I think vestibular rehabilitation is very important, especially for patients with vertigo that lasts for days to weeks to months. So a lot of times these patients, they have a weakness, they feel dizzy, and it's important to get the physiotherapist in to help them, to teach them how to rebalance and to adapt to that dizziness and overcome the dizziness as well. So I work with a lot of physiotherapists to help patients, especially with chronic dizziness. What exercises should you avoid if you have vertigo? I can tell you generally, if you have vertigo, you will not want to move a lot, okay? Because the more you move, the more dizzy you get. Because when you have vertigo, you're very sensitive to movement. But sometimes, if you have prolonged vertigo, that is where the vestibular rehabilitation comes in. Although you feel dizzy, we want you to move, we want you to exercise to overcome the dizziness. I always give patients an example. If you sprain your ankle or you injure your knee, you go for physiotherapy. And of course, that helps you to slowly get back into full function. Same principle with vestibular rehabilitation. So you go to the physio, they do exercise, you do it every day, every week, and then over time you adapt to the dizziness and you get better. So that's the idea of vestibular rehabilitation. Can vertigo be hereditary? Yes, certain ones like Meniere's disease and migraines. So I always ask patients with migraine, do you have a family history with migraine? Do you have a personal history of migraine? Did you ever have headaches, frequent headaches when you were younger? We also know that Meniere's disease, they would have a stronger family history of Meniere's.
Doctor Says 360.
If you like our channel, please like, share, and subscribe.